to a special course on protecting yourself from COVID-19 and the workplace. I'm Dr. Pervez Ahmad. This is lecture number 5. In this lecture, we will have a discussion on the key steps for preparing for and managing the epidemic and the workplace. Community spread can impact any workplace. Consider the impact on the workers, basic hygiene and social distancing, protecting workers. So let's proceed toward today's lecture. First we will have a discussion on the key step for preparing and managing epidemics and the workplace. So for this, first of all, we have to do the preparation for the threat, then implementing the preventive measures, and then implementing the continuity of the operation plan, managing businesses, recovery post and epidemics. So community spread can impact any workers. Mitigations may include shutting down events and work sites where people gather. For example, the National Basketball Association suspended its season on March 11, 2020. Many universities and colleges have suspended in-person classes and have moved to distant learning. Workers at stadiums, art centers, and other places where people gather are impacted. So consider the impact on the worker. Will a worker be paid if their workplace shut down or they are quarantined? What can be done for the worker who are sick but have no paid sick leave? How can worker cope with the impact if their child's school is shut down or their child is placed in quarantines? What can be done for the low wage and immigrant workers who have no access to health care? Other impacts. So, basic hygiene and social distancing include that one should stay home when sick, wear a mask, wash hand or use sanitizer frequently, and after coughing, sneezing, blowing nose, and using the restroom, avoid touching your nose, mouth, and eyes. Cover cough and sneeze with tissues, or do it and your sleeves. Dispose of tissues and no touch bans. Avoid close contact with the workers and customer at least 6 feet. Avoid shaking hands or wash hands after physical contact with others. So key elements: COVID-19's workplace plan, management, leadership, and employee participations, hazard identification and assessment, hazard preventions and controls, risk communications, educations and training, system evaluations and improvements, family preparedness, emergency operations procedures, post-pandemic recovery. Protecting workers start with the most effective method to protect workers, that is, physically remove the hazard, replace the hazard, isolate people from the hazard, change the way people work, protect the worker with the personal protective equipment. So that's all we have for this lecture. Stay tuned with the next lecture, because in the next lectures we will discuss the engineering controls, additional administrative controls, and decontaminations and respirators for protecting yourself from COVID-19 in the workplace. I mean, we will focus on the engineering controls and the last lecture for your protections from COVID-19. So stay tuned. Till then, bye bye.